Welcome to Introduction to Medicare, an introductory course for CFP certificates. Medicare is a national health insurance program in the United States that is administered by the Centers for Medicare and Medicaid Services, CMS. It provides health insurance for people who are 65 years of age or older, as well as for certain younger people with disabilities and for people with end-stage renal disease, ESRD. This introduction to Medicare is broken into 3 sections. First, we will discuss Medicare eligibility and enrollment. Second, we will cover Medicare Parts A, B, and prescription drug benefits under Medicare. The third section of this introductory course will cover Medicare and other insurance, such as Medigap, Medicare Advantage, and employer-sponsored coverage. To be eligible for Medicare based on age, you must be a U.S. citizen or permanent resident, 65 years or older, and a resident of the United States. In order to be eligible for Medicare Part A without premium, you need to be 65 years or older and have worked and paid Medicare taxes for at least 10 years. You may be eligible for Medicare prior to reaching the age of 65. If you are under 65 and have certain disabilities or conditions. To be eligible for Medicare based on disability, you must be under 65 years old, and receive disability benefits from the Social Security Administration or the Railroad Retirement Board for at least 24 months. There are other ways to be eligible for Medicare prior to the age of 65, if you have Lou Gehrig's disease, or have end-stage renal disease, ESRD, requiring dialysis. The most important enrollment period is called the initial enrollment period. If you are eligible for Medicare, you can enroll in the program during your initial enrollment period, which begins on the first date of the month that is 3 months before your 65th birthday and ends on the last date of the 3rd month following the month that you turn 65 years old. You can also enroll for Original Medicare during the General Enrollment Period, which runs from January 1st through March 31st each year, but if you have had no health insurance, then late enrollment penalties may apply. Let's take an example. Let's say that Mr. X turns 65 on March 15, 2023. His initial election period, IEP, would begin 3 months prior to March 1st, which means December 1, 2022. That is the first day that he can apply for Medicare Part A, and Part B coverage would begin on March 1st. If Mr. X applies at any time, during the month of March, or between April 1st and June 30, 2023, then Medicare coverage would begin on the first day of the following month. For example, if Mr. X applies on April 3rd, then Medicare coverage would begin on May 1st. It's important to enroll in Medicare during your initial enrollment period to avoid paying late enrollment penalties. If you miss your initial enrollment period, you may have to pay a higher premium for Part B and/or Part D coverage for the rest of your life. If you are working and have employer coverage when you turn 65, you may have the option to delay enrolling in Medicare until you retire or lose your employer coverage. However, it's important to carefully consider your options and compare your employer coverage to Medicare before making a decision. Now, let's discuss how to apply for Medicare. There are several ways to enroll in Medicare, depending on your circumstances. Here are the main options. Initial enrollment period. If you are turning 65 or are otherwise eligible for Medicare, you can enroll in the program during your initial enrollment period. Special enrollment period. If you are already enrolled in Medicare and you need to make changes to your coverage, you may be eligible for a special enrollment period. Special enrollment periods are available for certain life events, such as moving to a new area, losing other insurance coverage, or getting married. General enrollment period. If you miss your initial enrollment period, you can enroll in Medicare during the general enrollment period, which runs from January 1st to March 31st each year. If you enroll during the general enrollment period, your coverage will begin on July 1st of that year. Enrollment in Medicare is very confusing and there are many errors that can occur. Here are some insider tips that should be kept in mind in order to avoid undue stress while applying for Medicare. Procrastinating. While it may seem that 3 months is enough time to apply for Original Medicare, there may be many steps involved. For example, you may need to have your employer complete a form in order to avoid late enrollment penalties. Carriers may ask you for evidence to confirm prior coverage, and that evidence may not be easy to gather and forward to the carrier. Finally, even if you have done everything in a timely manner, there is still government bureaucracy involved, and at times, this can take more than a month, even if all the paperwork is in perfect order. Consider the non-Medicare spouse first. Sometimes, the decision to apply will depend on your ability to identify the appropriate coverage for a non-Medicare eligible spouse. That can take time, effort, and calculations in order to determine the most appropriate course of action. For example, a non-Medicare eligible spouse may be eligible for much lower premium and cost-sharing responsibilities. The bottom line is there are more moving parts than most realize, and even if you know all of the moving parts, then there are still factors that you do not control. So, it's best to begin your preparations early. Original Medicare is a fee-for-service health insurance program administered by the federal government. It is made up of two parts, Part A and Part B. Let's look at Original Medicare, Medicare Part A, Part B, and prescription drug coverage. Part A covers hospital stays, including inpatient care and some follow-up care. It also covers skilled nursing facility care, hospice care, and some home health care. Part B covers certain doctor services, outpatient care, and medical supplies. This includes services such as doctor's office visits, preventive care, durable medical equipment, and some home health care. Medicare Parts A and B do not include prescription drug coverage, except when administered in healthcare settings. Here's a quick description of Medicare prescription drug benefits. If you want prescription drug coverage, you will need to enroll in a separate Medicare prescription drug plan, Part D. It is also embedded within many Medicare Advantage plans. Let's begin an overview of Medicare hospital and medical coverage. Part A is known to cover inpatient hospitalization. Part A is generally premium-free if you or your spouse have worked and paid Medicare taxes for at least 10 years. If you are not eligible for premium-free Part A, you may be able to purchase Part A coverage for a monthly premium. Part A will provide benefits for inpatient hospital stays, including care in critical access hospitals, small rural hospitals with limited inpatient beds. There is a deductible. In 2023, that amount is $1,600 per benefit period. A common misunderstanding is that benefit period is not determined by calendar year. It is best understood as meaning medical event. If you were hospitalized for a long period of time, then for days 61 through 90, there is a $400 copayment each day. For days 91 to 150, there is a $800 copayment each day while using your 60 lifetime reserve days. After day 150, you pay all costs. Skilled nursing facility care. Skilled nursing facility, also known as nursing homes, care, including short-term rehabilitation stays are covered by Part A. Part A will cover skilled nursing facility care, if preceded by a 3-day inpatient hospital stay. Under Original Medicare, the first 20 days cost $0, followed by a $200 per day cost for days 21 through 100. After 100 days, you are responsible for the entire cost of a skilled nursing facility stay. Some home health care services, including part-time nursing care and physical therapy. Inpatient psychiatric care, blood, hospice. There are other benefits provided under Part A. There is a 190-day lifetime inpatient psychiatric care limit under Part A hospice care, which provides comfort and support for people with terminal illnesses, and 3 pints of blood per year are covered at no charge under Part A. Let's now turn our attention to Medicare Part B coverage. Part B, also known as medical insurance, helps cover doctor's services and outpatient care. It is one of the 4 main parts of Medicare, a national health insurance program in the United States. In 2023, the standard Part B premium is $164.90 per month. For higher income individuals and couples, Part B premiums can be higher, resulting from the income-related monthly adjustment amount, called IRMAA. The Social Security Administration will inform you if you are being assessed IRMAA. In 2023, Part B will have an annual deductible of $226. Once the Part B deductible has been met, then Part B will cover 80% of Medicare-approved charges for healthcare services, and you will be responsible for 20% of Medicare-approved charges, and 100% of Part B excess charges, if levied by your healthcare provider. In certain states, Part B excess charges are disallowed as a result of state-specific regulations. In general, Part B provides benefits for doctor services, including visits to primary care providers and specialists. It also includes outpatient care, including diagnostic tests and procedures, like X-rays and blood tests. Durable medical equipment benefits are provided by Medicare Part B. Infusion, chemotherapy in healthcare setting are usually covered by Medicare Part B. Part D provides prescription drug benefits under Medicare. Part D plans are sold and administered by health insurance companies. Medicare regulations mandate that you have prescription drug benefits, Once you are eligible for Medicare Part A, on a continuous basis, without a break that lasts longer than 63 days. If you do not have continuous coverage, deemed to be creditable coverage, then you will be assessed a Part D late enrollment penalty that will not expire. Prescription drug benefits may be obtained from other sources, such as Medicare Advantage, employer-sponsored coverage, or the Veterans Administration, among others. All Part D plans will meet the minimum standards set annually by the CMS. Every Part D plan will have a formulary, a list of approved medications. All medications within a Part D plan will be assigned a tier by the specific Part D plan. In addition, there will be separate deductibles, copays and coinsurance schedules for each Part D plan. Finally, each Part D plan will have a set of pharmacies that will accept your Medicare prescription drug coverage plan, whether that is Part D or within Medicare Advantage. There is a complicated set of stages when describing Medicare prescription drug benefits. Specifically, there are 3 stages. First, the initial coverage stage. Beneficiaries are responsible for paying a yearly deductible, which can be up to $505 in 2023. After the deductible is met, beneficiaries pay a copayment or coinsurance for their drugs, which typically ranges from 25% to 33% of the drug cost. Second, the coverage gap. Beneficiaries enter the coverage gap, also known as the donut hole, when their total drug costs reach $4,660 in 2023. Once in the coverage gap, beneficiaries are responsible for paying 25% of the cost of brand name drugs and 37% of the cost of generic drugs. Catastrophic coverage. Beneficiaries enter the catastrophic coverage phase when their total out-of-pocket costs reach $7,050 in 2021. Once in this phase, beneficiaries pay a small copayment or coinsurance for their drugs, usually around 5% of the cost of the drug. Like Part B, premiums for Part D can be affected by income, IRMMA, which is determined annually by the Social Security Administration. In this section, we will take a quick look at Medigap, Medicare Advantage, and the task of coordinating Medicare with employer-sponsored insurance. Medigap coverage is very simple and straightforward. There are no networks. Medigap will be accepted by every healthcare provider that accepts federal Medicare. Medigap will cover all costs associated with Part A. You, the policyholder, will be responsible for the Part B deductible, $224 in 2023. Once you have met the Part B deductible, and the CMS possesses records that you have met it, then Medigap will cover all of the 20% that Part B does not cover. For policyholders of Plan G, Medigap will cover the Part B excess as well. During the Medigap open enrollment period, your application will be approved, and you can choose any Medigap plan available by any insurance company that offers Medigap in your geographical location. During the Medigap open enrollment period, insurance companies cannot deny you coverage, nor can they charge you a higher price based on your medical situation. Guaranteed issue, Medicare protections. Guaranteed issue is slightly different than Medigap open enrollment. You will be able to select a subset of Medigap plans if you are entitled to a special enrollment period, SEP. Then you can enroll in plans A, B, G, K, and L, without medical underwriting. 2 features of Medigap make it extraordinarily stable. Let's call these features standardization and grandfathering. Through standardization, the coverage for all plan ends is the same, regardless of insurance company. That makes it easier for medical provider, administrators, billing personnel to understand. The idea of language that changes from company to company, odd definitions that change, and hidden language simply does not exist. The second and potentially more important reason that a Medigap policy is superior to any other policy is because of the grandfathering characteristic. This is known as guaranteed renewable. As long as you continue to pay premiums, the policy remains in effect as was originally written, unless it is changed by the CMS. The only party that can cancel your policy is you. As long as you continue to pay the premium, renewal is a certainty, with no action required. Segment 12. Let's now take a look at Medicare Advantage. Medicare Advantage is a Medicare health plan offered by insurance companies that are contracted with Medicare. The insurance 50 maximize your Medicare company administers all aspects of benefits, billing, and costs. When enrolled in a Medicare Advantage plan, the insurance company will issue a member card that is to be presented to healthcare providers and pharmacies. You will no longer use your traditional red, white, and blue Medicare card, This does not mean that you should discard your traditional Medicare card. In 2021, Medicare Advantage plans represented 42% of all Medicare beneficiaries, and the popularity of these plans is growing rapidly, a trend that is certain to continue for the immediate future. In many locations in the United States, there may be 20 Medicare Advantage plans available to choose from. And in some areas, there are more than 80 separate Medicare Advantage plans available. You need to be enrolled in both Medicare Part A and Medicare Part B. The only exception to this is a Medicare Cost Plan, MCP, to be discussed later in this chapter. MCPs are only available in a limited number of locations. You cannot be covered by a Medicare Advantage and Medigap plan at the same time. At a minimum, Medicare Advantage plans must cover at least what original Medicare covers, on average. 1. There are different types of Medicare Advantage plans. Medicare Advantage plans that do not include prescription drug coverage are referred to as MA plans. Medicare Advantage plans that include prescription drug benefits are referred to as MAPD. Medicare Advantage prescription drug plans. Each year, Medicare Advantage plans are allowed to advertise to Medicare beneficiaries. You are likely to receive many advertisements through the mail regarding Medicare Advantage plans, and will also see television ads. Medicare Advantage plans available in your area are listed on the Medicare website at www.medicare.gov, and they may be listed in a physical copy of Medicare and You can also call Medicare at 1-800-MEDICARE. Let's now examine how Medicare interacts with employer-sponsored health insurance when you are a full-time employee. Large employer, 20 or more full-time employees, employer insurance pays first. If you are working and covered by health insurance provided by your employer, then you can delay enrollment in Medicare Part A, Medicare Part B, and Medicare Part D. It is usually the case that people enroll in Part A since it has no premium. At large employers, the employer-sponsored plan is the primary source of benefits, and Medicare Part A will be secondary, thus possibly reducing your overall financial responsibility. If a person has an HSA bank account, special care must be taken here, because you cannot contribute to an HSA and simultaneously receive Part A benefits. You can withdraw for health-related expenses at any age. If your health insurance includes prescription drug benefits, then you can delay enrollment in Medicare Part D for 63 days. 63 days is the maximum number of days that you can be without prescription drug benefits and avoid the Part D late enrollment penalty, if you are 65 years old or older or enrolled in Medicare Part A. For employees at small employers, Medicare and employer-sponsored plans work differently. If the employee at a small group employer, defined as fewer than 20 full-time employees, enrolls in either Part A or Part B, then Medicare is primary, and the group-sponsored health insurance plan will be secondary. Special care will need to be taken here, because the prescription drug benefits must be certified to be creditable, which means that it is at least as good as Medicare Part D, and that certification comes from the CMS. There will be an explicit explanation in a summary of benefits. The most frequently asked question we receive, from full-time employees and other brokers, is, can I delay if covered by employer-sponsored insurance? If you are covered by health insurance from your employer, and you are a full-time employee, then you can delay enrollment in Medicare Part B if your employer-sponsored plan includes prescription drug benefits that is deemed to be as good as Medicare, called creditable coverage. Then you can delay enrollment in Medicare Part D if either does not apply. Then you do need to enroll in Medicare Part B and/or Medicare Part D before the initial enrollment period expires. Here are some more frequently asked questions. Let's address some frequently asked questions when it comes to how Medicare interacts with other types of insurance. Affordable Care Act. You can simultaneously be an individual health insurance member and be enrolled in Medicare without late enrollment penalty. However, you cannot receive the Affordable Care Act's Advance Premium Tax Credits, APTC, while eligible for Medicare. Veterans Administration. Veterans Administration prescription drug benefits count as Part D creditable coverage. Therefore, you can elect to become a Medicare Advantage member if you are also enrolled in Medicare Part B. In addition, you could separately purchase a standalone Part D plan. COBRA. COBRA is granted to those who are no longer eligible for employer-sponsored health insurance, but cannot be used as a reason to prevent the Part B late enrollment penalty, beyond 8 months. However, COBRA can prevent you from incurring a Part D late enrollment penalty. Medicare is subject to change over time, and there may be changes to the program that affect your coverage or the costs you pay for healthcare services. Some common examples of changes to Medicare include changes to covered services. Medicare may add or remove coverage for certain medical services or items. Changes to premiums, deductibles, and cost sharing. Medicare may change the premiums you pay for coverage, as well as the deductibles and copays you pay for medical services. Changes to plan options. Insurance carriers will change the details of cost and coverage available within Medicare Advantage plans and Part D prescription drug plans. There are always going to be developments to the Medicare system. As a result, it is advisable that you keep up to date. For example, recent changes to regulations have resulted in new in 2023, insulin capped at $35 a month copayment. New in 2025, Part D maximize out-of-pocket will include a limit of $2,000 a year. These are just a few examples to illustrate that Medicare will evolve, as it continues to grow, beyond its 65 million current beneficiaries.